Good evening, everyone. Thanks for joining us. In just a few days, hospital patients all over will be able to see what the charges are for their medical procedure. Starting in 2019, a federal rule requires all hospitals to post the prices for common procedures. Our Quentin Smith speaks with a hospital administrator in our area about this change. He now joins us live in the studio with more. Hey, Quentin.
Yes, Scott, this now allows patients to shop online for the best and lowest hospital prices. Hospital leaders say this new rule will be beneficial because it brings about transparency. However, they say it could also lead to confusion. Whenever someone gets sick, they usually go pay the doctor a visit at the hospital. However, sometimes the amount of money patients are being charged for their procedure can catch them off guard. But starting in January, that will no longer be the case.
The new rule is basically the Centers for Medicare Services is requiring all healthcare facilities, hospitals, to post what is referred to as the charge master out on our website. It has to be in a machine-readable format.
The new rule will show charges for all procedures in which that specific hospital or facility performs. Winston Medical Center CEO Paul Black says the new rule will be beneficial because it will provide more transparency for pricing and patients. However, he thinks it might also be confusing.
We don't have an insurance company out there that pays us based on what our charges are. We have contracts with the insurance companies, and some of us pay a 6% of Medicare. Some of us pay a negotiated rate, both for inpatient and outpatient ER services. So really the charge is insignificant. It's something that's put out there so that we have to adjust the patient's bill accordingly.
Black says despite the charges being listed, it still doesn't give the patients the exact dollar amount that they'll have to pay out of pocket for their procedure.
Prime example is that we could do a service and provide a service that the charges are $1,000. Our contract with the insurance company says we're only going to pay you $800 for that service. Well, we've got a contract with them, so we accept the $800. We're writing off the $200 difference as what we call a contractual adjustment, and we make no attempt whatsoever to collect that $200.
Now, under the new rule, each medical facility has to update its prices online at least once a year. Black says his staff is currently in the process of gathering all of their information ahead of the January 1st deadline. Scott?